how long you've had this fear of heights. This is a psychiatrist in practice. Let me tell you that therapy will never work for a person with a fear of heights. Now, panic attacks. The whole theory about panic attacks underwent a revolution in about in the late 1970s, early 1980s. And it was really here, this period of time, and these studies were being undertaken in the New York Psychiatry Institution where I've been, this was for the first time panic disorder and panic attacks was in fact identified. And if you go back in literature, even in Shakespearean time, and even there's reference made in the Bible and other Greek, and also during Greek times and Greek writings about the occurrence of panic attacks. They are not a new phenomena, but they were only firstly described in the 1980s, particularly in our diagnostic manuals. Now, what are the characteristics of a panic attack? Palpitations, pounding of the heart, sweating, trembling, shaking, sensation, shortness of breath, feeling of choking, chest pain or discomfort. Who in this room, by the way, suffers from panic attacks? Hands up, okay. Who in this room has actually ever suffered from chest pain from panic attacks? Right, I won't let you to get up here, but I want you to do something. I want you to take your hand like this, okay? Nobody's watching it. And go down your rib cage. In fact, all of you can do this, by the way. Okay, go down your rib cage. What do you find? Your rib cage goes up and down. And in between your ribs is muscle called the intercostal muscle. And why do we need muscle between, or tissue between the bones, ribs? Because you put two bones together, they're going to erode away. So we need muscle there. Now I guarantee those people in this room who have panic attacks, if you go home and put a book on your tummy, you'll find that book will not go up or down. Because people with panic attacks are indeed people who are thoracic breathers. When they get anxious and distressed, they breathe more rapidly and they strain the rib cage, that is the muscles, or the intercostal muscles between the ribs. Of course, some people, when they get this chest pain, think they're having a heart attack and raced off to the medical centers. Of course, they can't find any indication of any heart disease. And what we've got to do is get people to recognize that the chest pain is indeed a result of those muscles being stressed. Feeling dizzy, lightheaded or faint, derealization or depersonalization, feeling of losing control or going crazy, fear of dying, paresthesia, which is lots of pins and needles, chills or hot flushes. A panic attack peaks in 10 minutes and lasts for up to 30 minutes. What causes a panic attack? Let me tell you. I talked about before how if a saber-toothed tiger came into this room, you and our bodies would be activated, ready to flee or fight. That's something physical we can see, some threat we can perceive. But what if the oxygen content in this room suddenly fell? Wouldn't we need some alarm system in our body to alert us to the fact, hey, we could be suffocating here? Isn't that sensible? To our bodies to be designed this way, to evolve through evolution? Well, we do have this mechanism in our brain to alert us to when air quality is changing so we can in fact get out. People with panic attacks have a faulty mechanism. Those people with panic attacks are always concerned about the availability of fresh air. Okay? They don't like tight clothing around their neck. When I look around an audience tonight, I think I can make the diagnosis of many of them just by looking at people's necks. Okay? That's true. When a person comes and sits down in front of me, often I can tell within 2 minutes what's wrong without even asking them the question. They will, when they're in a motor car, they'll keep the air conditioning on or the window open. And even on the coldest of days, they'll keep the window open at home. I've been in houses with people with panic disorder. They've had the back door and the front door open. What else can I tell you about them? Generally, they sigh a lot. And they yawn a lot. Do you yawn and yawn a lot? Yeah, I can describe you without even knowing your name or sitting down next to you. And what are you doing when you're sighing and yawning? You're breathing off a bit of extra carbon dioxide. Because carbon dioxide becomes toxic after a while. So you yawn and you sigh. So what causes panic attacks really is a faulty respiratory phenomenon. Let's talk about your chest pain. I've explained that to you. You're actually straining your muscles. You're not, in fact, having heart attacks. I had a patient who was taken on 7 occasions to Monash Medical Center, believing that he was having a heart attack. The paramedics thought he was having a heart attack, but when they got there, they could find nothing wrong. When a person has the first panic attack, it's something you should, in fact, take seriously. Because 30% of the population will experience a panic attack in a given year, and even a larger percentage at some point during their life. 66% after a single attack will go on to develop further panic attacks. And when people have further panic attacks, we actually call that panic disorder. 33 to 50% of those who suffer a panic disorder will go on to develop agoraphobia. That is, they go around developing avoidance behaviors so as to minimize the chances of developing a panic attack. They won't leave the home. They may require somebody else always present. They won't travel by public transport, and so on. I had one person who had panic attacks, and he was most severe about their occurrence. People with panic attacks are always concerned about their own safety. And he shifted right next door to a doctor's property. And he had to make sure that he was in bed before the doctor left to go home that night. Another one was a salesman, and he knew he traveled, had organized his routes around Melbourne according to where doctor's surgeries were. Dissociation. This is an important part of panic symptoms. This is where people really feel they're there but not there. It's a frightening experience. But people who have this symptom as a part of panic, or even in general, and anxiety generally, they have more panic attacks. Their symptoms are more severe. They experience greater disability, but also they're much more difficult to treat. This is the dissociative part of this, where people feel they're not there, or their body is shaped differently, or the world just seems differently through their own eyes. And it's due to the front part of the brain processing the world a wee bit differently. Panic attacks may occur in any other type of anxiety disorder. They may occur in specific phobia, which we've spoken about. They may occur in social anxiety disorder. They may occur also in obsessive compulsive disorder as well. There's 2 major groups of people with panic disorder. Those with non-respiratory symptoms. Okay? This is the dizziness, the palpitations, the flushes, the trembling, the sweats, the nausea, depersonation. These tend to be more situationally bound. People with these attacks are having attacks which are specific to certain situations. They're not a generalized attack. That is, sometimes people with panic disorder, their attacks are really specific. Sometimes they occur absolutely everywhere and indeed quite unpredictable. And the respiratory symptoms associated with choking, a smoking sensation, chest pain, numbness and tingling, and often they have fear of dying. And people with the respiratory symptoms, and I think these are the much more common ones, these are the ones which have more spontaneous attacks. That is, they just occur out of the blue. And this is what I was mentioning before. What we've called this panic mechanism in our mind is the suffocation false alarm hypothesis. We all possess this monitoring system in our brain, but those who suffer from panic attack, they really have an extra sensory monitor. And they go everywhere out of their way to make sure that indeed fresh air is available. Often when they'll travel on aircraft, the first thing they'll do is make sure they've got an air nozzle pointing towards them.